Dr. Peter Abramson is one of the most respected facial plastic surgeons in Atlanta. We recently had a chance to talk to him about some of the most common procedures and some of the newest techniques in facial plastic surgery. Here's Dr. Abramson. And we have so many questions to ask you, Dr. Abramson. As one of Atlanta's premier facial plastic surgeons, we'd like to talk to you about each area of the face and some of the most common procedures and questions that you get from patients.
I'd say probably the two areas patients come in and ask most about are the areas around the eyes, as well as areas around the lips and chin, and the lines next to the nose and the lips as well.
Well, let's start with the chin. What are some of the most common procedures or ways that you can actually enhance that area?
Well, we look at the chin in combination with the rest of the proportions of the face, including the lips and the nose, even the forehead comes into play as well. But what we look for is the areas that are next to the chin, which start to have a little dip in them over time, as well as some people that either over time have lost a little projection in their chin or were born without much projection to begin with. The lips play into that because our lips tend to get a little thinner as we get older, as well as they lose some of the structure and the nice curvature that you see of the lips, as well as some of the fullness.
Is surgery always required in that area, or are there other ways that you can enhance it?
Not always, and as a matter of fact, most of the time what we're doing is rejuvenating or filling those areas that seem to have lost some volume. For instance, we like to put a little bit more structure along the edge of the lips. One of the other areas that patients always ask about is around their eyes, but many times patients don't realize that it's really the lower eyelids and the cheek area is very much one and the same, and in order to rejuvenate that area you have to approach both. The cheeks, many times we're able to increase the volume that's been lost as the cheek becomes a little flatter over time. And the eyelids, many times we can also increase a little volume along the bottom of the eyelid where it meets the top of the cheek. Although there are many patients that also need eyelid lift surgery, which is also easily accomplished on an outpatient basis.
Dr. Abramson, you've talked a lot about adding volume to specific areas of the face. Once you do that, how long would those effects last?
Well, different products have different time spans that they seem to work. Most of the products will get slowly resorbed over time, depending on where they are placed in the face. We're really excited about a new product called Evolence. It is a new re-engineered collagen that lasts up to 12 months. When it's injected, it provides a nice subtle and soft result. Most of the time we're placing it right next to the nose in the little folds that form between the nose and the mouth. And we rarely see bruising or swelling from the product.
Now, can they have that procedure done in the office?
Sure. A patient could come in and then have the procedure done and be back at their office or whatever they would like to do for the rest of the day after they leave.
Well, I live in South Carolina, and I was recommended to Dr. Abramson from a friend in South Carolina. I'll drive 3 hours just to see Dr. Abramson because I trust him so much. I've been coming for about 3 years now. I had a brow lift done by another physician, and I was extremely dissatisfied with the result. Dr. Abramson was able to even out the eyebrows. And then later on, I noticed that I lost a lot of volume in my face. In fact, it just wasn't as full as it used to be. And I asked Dr. Abramson if he could help me with that. And he was able to use fillers to fill out my face. In fact, I had some fillers done a few minutes ago. I'm able to leave the office, go home, and no one would ever know. I'm absolutely thrilled with the results. I mean, I couldn't be happier. I think I look younger, I feel better, and I'm so happy. And I would recommend Dr. Abramson to anyone who's thinking about facial plastic surgery or any facial procedures.